Hi, I'm Doug. We're going to do a head-to-toe assessment for Cumberland University. I have my helper over here. Christy's going to be the patient. And this is for the end of semester. It's for the assessment class. And we're going to do looking at review of systems, past medical history, looking at medication list, any surgeries. We're going to start with the head, neck, anterior chest, posterior chest, extremities, do pulses, lung sounds, heart sounds. And so we're going to start by getting Christy, my helper. Thank you for helping out. She's going to get on a scale. We're going to test for mobility. I've washed my hands prior to coming in, and use a little gel on my hands because washing hands saves lives. We're going to provide privacy in our makeshift examination room. As I'm seeing Christy stand up, I'm looking at her mobility, seeing how she's walking, standing from a sitting position. Her mobility seems to be good. So if you can, we're going to just come over here and you're going to have you sit on your table. And we're going to start out by getting a past medical history. Can you tell me any past surgeries, history of any health problems, any medications you're taking?
I've had my wisdom teeth out, and I had knee surgery about 2 years ago.
Okay, and osteoarthritis, or was it an injury?
I'm not really sure how it happened, but something at the top of my knee tore, and they had to go in there and replace it.
Okay, so arthroscopic surgery?
Yes.
And that went well.
Yes.
Any other medical problems?
Sometimes a skipped heartbeat.
Oh, okay. Have you had a diagnosis for that?
Yes.
What was the diagnosis? Is it regular?
Yes, just too much caffeine.
Oh, too much caffeine? Okay. So you haven't cut caffeine out?
No.
Okay. We're going to work that into a care plan.
Okay.
You're not having any chest pain, shortness of breath, anything like that at present?
No.
Okay. Oh, one more thing. Medications? Any medications you're on?
Just general vitamins.
Just vitamins, but no
fish
prescribed.
oil.
Okay,
No
prescription.
prescription.
Wow, that's great. You're healthy then. We're going to start off by getting your vital signs. And you can just stay seated there. I'm going to get your temperature. You can hold that under your tongue till it beeps. Hold it with your right hand for me. And on your left hand, I'll get your blood pressure. And I'm going to check your pulse as we're doing it too, just to see if the machine is accurate. We have your weight at 142 pounds. Did it beep yet? Okay, great. 98.2. We're going to save that and record it later, soon after the exam's over. Do you have high blood pressure?
No.
Okay, your blood pressure is 133/90.
Is that high?
Well, your diastolic's a little high. You have a 72 map. But yeah, and it might just be the stress of doing the video, but we'll see later. Heart rate is 88. And respirations, I was counting as we were going, are within normal limits. 16. Turn this off. Before I usually lie down and start the assessment, I'm going to get you to stand up and we're going to measure you.
All right.
Okay. 63 inches. And then afterwards, we're going to calculate your BM, your body mass index,
Okay.
your weight, and your height.
All right.
Okay, let's start off with your assessment by looking at your doing the head to toe, as we said.
Okay.
And you can have a seat here. And we're going to start doing the head to toe assessment by looking at the head. We're going to look at the scalp and the hair. We're looking for cleanliness, for any lesions on the head. And we're going to palpate the scalp, looking for any lumps or any irregularities, abnormalities. And her scalp looks clean and dry. The hair looks normal, no alopecia noted or anything like that. The cranium is symmetrical and even within normal limits. Not having any pain?
No.
Okay. And as I'm palpating the head, I'm also going to look at the maxillary sinus. You have any pain there?
No.
Okay. Maxillary sinus and frontal sinus. No pain when I palpate, when I touch your face?
No.
Okay. Move on here.
No.
Okay. Okay, we're going to look at CV's eyes, and I'm looking for pupil response. I want to look at the sclera, conjunctiva. The sclera should be china white, and it is. There's no abrasions or scratches or deformities. And I'm looking at the pupil response at the same time. His pupils are 3 millimeters, consensual and reactive. And look at the conjunctiva, and it should be pink, and it is. Do you have any vision problems?
I'm nearsighted.
Nearsighted, wear glasses?
Yeah.
Reading. Okay. So the eyes look normal, within normal limits. Now we're going to do cardinal fields. We're going to look at the ocular movement of your eyes. That's the muscles of your eyes. You keep your glasses on, whichever is good for you, because you're going to be following my fingers as I go to different fields. You're going to keep your head straight. We're going to also look at cranial nerves 2, cranial nerves 3, 4, and 6. Okay, by looking straight ahead, I want you to follow my hands to the 6 cardinal fields with your eyes. The cranial nerves are within normal limits intact. There's no problems at all. We're going to go to the nose next. Take a look at your nose and look for symmetry. Did you say you have sinus problems or allergy problems?
I do, yeah. My allergy doctor told me that the sinus right here is swollen.
Okay, do you have a deviated septum?
Not that I'm aware of.
It doesn't look like it. It looks like the nose is symmetrical. Your face is symmetrical within normal limits. And you don't look like you have a deviated septum. What are you doing for the sinus?
He's going to operate on it in November
Oh, you're going to have
clean
surgery?
it out.
Okay. Any other treatments? You taking any allergy medicines or anything?
I was taking allergy drops, and they helped a lot, but I finished the treatment.
Okay. Okay. I'm going to move on to your mouth. We're going to examine your mouth, your lips, and your teeth. We're going to say, ah. I'm looking at the uvula, and it looks normal. I see your tonsils are still there, and they're a +1. There is no exudate. And I'm looking at your top of your mouth and the floor of your mouth. I'm looking for any imperfections or irregularities, any ulcers, or anything like that, and I don't really see anything. Say ah one more time. I'm looking at your gingiva, and it's pink. So that's within normal limits. I'm looking at the symmetry of your face, okay? And we're going to move on to your ears, okay? We're looking at the external structures of the ears, and they look symmetrical. We're going to do a little test. I want you just to see if you can hear me. It's called a whisper test.
Yes. Yes.
And the whisper test is just to see if you're able to hear on both sides of your ears equally. From there, we're going to move down to your neck. We're going to start to examine your neck. And when we're looking at the neck, we're looking at the trachea to make sure it's midline. We're looking at we're inspecting the skin. And throughout our entire assessment, we're always going to look at the skin in every part of the body to make sure it's within normal limits, normal color. There's no lesions or any kind of bumps or anything that's abnormal. But at the neck, we're also looking at the skin, but we're also going to palpate the structure of the neck. We're going to feel your carotid pulse and see if it's present. And your pulse is strong. We're also going to palpate the lymph nodes to make sure there's no tenderness or swelling or lumps. Is it tender?
No, not at all.
Okay. Have you had any problems or anything lately with any kind of infections or anything?
Not that I'm aware of.
Okay, good. Well, it's within normal limits. We're going to move downward. We're going to look at your chest, posterior chest, your back. Look at your shoulders, and we're looking for symmetry. And from here, it looks like your shoulders are symmetrical. Did you have arthritis in your shoulders? I know you said you had some problems with the knee.
It's more in my neck, because I had a wreck several years ago and hurt it.
Okay.
Than in my shoulders.
Okay.
And also, when I was a child, I broke my collarbone.
Okay.
So if they're not symmetrical, that's probably why.
Okay, I'm going to have you stand up and hold your hands to the side. And then you're going to put your hands above your head. And there's crepitus noted to the right shoulder. You can go do it again. Crepitus noted and popping to both shoulders. Do you hear anything?
I did.
Can you feel anything? Does it hurt?
It doesn't hurt, but I heard
Wow.
the pop.
Yeah, there's notable pops on both shoulders. Now, I want you to put your hands behind like that. And I want to feel your shoulders as you do it. Put your hands to your side again. Okay. Any pain?
No.
I don't see any popping when you do that. Okay. Let's get you to lay down, and we're going to listen to lung sounds. We're going to listen to your heart. We're going to get your pulses. We're going to get your abdomen. Okay?
Okay.
So, we first inspect, from what we can see, we're going to look at the visible part of the chest and the abdomen. And we're going to also listen to lung sounds to make sure they're within normal limits. Any lung problems?
I had asthma when I was a child, but I got over
Okay. Are you a smoker?
it. No.
Okay, good. And we're going to listen to your lung sounds on your back also. Deep breath in and out. In through your nose and out through your mouth. In through your nose and out through your mouth. Okay? There's no murmurs. Heart sounds are within normal limits. I'm going to listen to the apex of the heart. The precordium to listen to the heart with the bell of the stethoscope. And as I do, I'm also going to get an apical pulse. See if it's palpable. And this is best achieved by kind of laying towards your left if you can. If you can kind of just lay towards your left, and the pulse is palpable. Now I'm going to get you to sit up a little bit. Here, I'll help you up. You stay there. I'm going to continue to listen to lung sounds. Okay? You may want to have you turned so the camera can see it too. There's structures on the back, like the shoulder blades, that'll block sounds. So we want to kind of listen through this area so we can hear lung sounds a little better. Deep breath in and out. Okay, you can turn around again, and while you're sitting up, we're going to listen to the lung sounds one more time. And of course, we want to make sure lung sounds are present, but we also want to make sure they're clear and that they're bilaterally equal. Deep breath in and out. Okay, you can lay back. I'll be back.
Thank you.
We're going to go on to the abdominal assessment. And with the abdomen, we always inspect first. That means looking, auscultate, percuss, and then palpate. We're not going to percuss, but we are going to just look at your abdomen, okay? And just look for any abnormalities or any incisions. You had no surgeries, abdominal surgeries, so there's nothing there. So our inspection is within normal limits. We're going to auscultate to listen to bowel sounds. That's just kind of like when your stomach's growling.
Okay.
This just lets you hear it a little louder. You can breathe normal. And sometimes bowel sounds are hypoactive. You want to listen for a full minute in each quadrant. We're going to listen to all 4 quadrants going in the circle. Your bowel sounds are present. Okay, bowel sounds are present in all 4 quadrants. Next we're going to go on, like I said, we're not going to percuss, but we're going to palpate. And that just means simply to touch. We're going to palpate the spleen. Your spleen is right in here, and it's palpable. You can feel it. I'm going to also look for any tenderness. Your belly tender?
A little tiny bit down here, but not bad.
Okay. tender when I touch it?
Yeah.
Okay, it is?
Not bad, just a little.
Okay. Is that new? Is that something going on?
I'm not sure.
Okay, I'm not pressing too hard, right?
No.
And we're also going to palpate the liver. And the liver, just a little bit of the liver is palpable. It's up under the rib cage. If it were notably palpable in the lower part of your upper right quadrant, there may be liver problems. So you seem like everything's normal there. We're going to palpate the kidneys. Any pain?
No.
Okay. Abdomen's within normal limits. We're going to take a look at your pulses. I think I checked your one pulse before, but I'm going to take a look at your other pulses. Like I said, we're always looking at skin as we go through the head to toe assessment. Your skin's within normal limits. Your capillary refill is less than, well, it's about 1 second, so it's definitely less than 3 seconds.
Is that good or bad?
That's good. You want it less than 3 seconds. If you smoked a lot of cigarettes, if you were somebody who had COPD or heart problems, your fingers might be blue. See capillary refill? Your finger turns white. You can also just press the pads of your finger, it'll turn white. And you want it to turn pink rapidly. Less than 3 seconds is normal. And yours is very rapid because you're not a smoker and you're healthy, you take care of yourself and exercise and do all the right things. Okay, great. Let's go to the lower extremities, and while you're lying down, I'm going to look at your feet. I'm going to palpate your pedal pulses. Pedal pulses are +2, and radial pulses are +3. Tibia pulse is also +2. I'm going to check the legs for any edema, any swelling. There's no edema noted to the lower extremities. Skin is pink again. No lesions, no abnormalities. I want you to push the brakes and the gas at the same time. Pull your toes back towards your nose. Push the brakes and the gas like you're driving a car, hard as you can. Pull your toes towards your nose. Okay. Strengths are within normal limits, +5. Bend your knees. You got a little pop in that right knee. Is that the one that had the surgery?
My left knee has.
Oh, okay, the right one pops. There's a little, I'm not sure. Let me feel. Do it again. Yeah, it's not. There's no crepitus though. There's no grinding. Or it's a little popping, but sometimes popping is healthy if it doesn't hurt. It's healthy to pop it. It's not going to hurt it. If there's crepitus, you want to, of course, see a doctor. I'm going to take both your hands. I want you to squeeze my hands hard as you can. Pull me towards you. Push me away. Strengths are within normal limits, +5. Let me get you stand up, sit up one more time. Okay? And we're going to review systems, make sure if we missed anything. I'm going to cover the face, head to toe assessment. We covered the face, the eyes, the nose, the mouth, the ears, the neck. We did the carotid pulse. We did the lymph nodes. We did the extremities. Range of motion is all good. Lower extremities, palpable pulses. We did lung sounds, heart sounds. We looked at the anterior and posterior chest. We looked for some symmetry in your shoulders, in your extremities, your facial structures. Everything seems to be within normal limits. You do have some crepitus in your shoulders, but they're not really causing you pain or problems. One more thing I want to check, something. It's called tactile firmness, and I want you to say blue moon.
Blue moon.
A 99?
99.
Okay. Blue moon?
Blue moon.
99?
99.
And tactile firmness is just the transfer of sounds from your chest and your back to my hands. And we're not looking for, everybody's a little different because some people are a little heavier or thinner. It's going to sound different, but we're looking for bilateral equalness. So we want to make sure everything is bilaterally the same on both sides. So the tactile firmness shows that the sounds are the same. So that's the head to toe assessment. We've touched on all the systems. We're going to work out a little care plan and a little education. We're going to put it all on paper. And soon after the assessment's over, we're going to calculate the BMI, body mass index, put everything on paper, submit it, and